Hello, welcome today to the training on how you can actually prepare for your IVF or fertility in a way that actually increases your chance of getting pregnant by an extra 30%, or even 3 times more than you're actually expecting for the pregnancy. And we're also going to be discussing the financial support, 5 year financial support for some persons that are going to be eligible. Essentially, we are going to make this into a two-part discussion so that we don't get sidetracked. So we start with how you can prepare for your IVF or improve your fertility profile if you're trying to get pregnant, and then we now discuss the fertility support, the IVF support, and how you can actually get access to it. The first thing that you should understand is that this program is specifically for you if you are planning to go for IVF or preparing to go for IVF. Even if you are just starting your procedure right now and you want to see what else you can do to optimize your chance of actually improving your success, this is for you. If you have been trying to get pregnant for some time and you want to get pregnant right now and you want to see what you can do, this is for you. And if you are also a person that has done an IVF before and you're about to go for another cycle of IVF and you want to see what you can do differently to make your chances of IVF success higher, this is also for you. Most people, when they're about to go for IVF, what actually happens is they just come into the procedure thinking that you just that's how it goes. But doing IVF is like the person that goes for, you remember those inter sports or those sports days that actually happened back then in high school, primary school, secondary school, whichever one, and even the university level, right? Do you remember any of those sports days? So think back to those days and consider this scenario. Somebody just comes in, he has never done any sports before, he was not even training during the training session, it's the day for the actual sports, and expects that it's going to run and outrun everybody that has been training before. Does it happen like that usually? It doesn't, right? It doesn't usually, because the person that trains tends to do better most times than the person that just comes in and expects that they are going to get the best result. Yes, are there people that they can come in sometimes and they just, without any preparation, they go into the procedure and then they get success? Yes, that happens for a number of persons. But we have actually now seen, studies have shown, even recent study up to the ones that were even released within this month of May, the ones that came in from October 2025 last year to now, have shown us that if you optimize your patient and if you optimize yourself before going for the IVF procedure, you are going to have a better result. And this is irrespective of how wonderful your protocol is or all of those things. But there are certain limitations to why hospitals are not yet able to implement this actual thing. There are a lot of limitations to it. So what we're trying to do now is ensure that you know what you need to do, how to do it, so that you can now improve your success and make yourself more likely to have your pregnancy within either your first IVF trial or your next IVF trial, or within the next 60 to 90 days if you are trying to get pregnant. Now, why this thing is very important to me is because I've seen the difference that can be made when you optimize the patient and get your very good result. And this reminds me right now of a patient, Mrs. Basisi, who actually ended up having triplets during her IVF. Okay, no, she actually had quadruplets during her IVF. I recall now, because for her, what happened was it was over a decade of trying to get pregnant and not had some success, but was very scared of going for the procedure. So did the optimization, transferred 3 embryos into her womb. But interestingly, despite the fact that 3 embryos were what we transferred for her, one of them also split and her body accepted all 3 of them. And that was how she ended up having 4 babies from my IVF procedure on her first trial. So work with me so that you can get everything that you need. The first thing that you need to understand is, who am I? Why some of you may have seen me before, because some people know me as the IVF doctor, others may not know me before, and this is the first time you're actually coming across my page or who I am on this social media space. This is the first time you're seeing me in this training. My name is Dr. Samuel Arotiri. I'm a fertility doctor, highly interested in getting women pregnant. In fact, as it is at this point. There's no state in this country that I've not had a patient coming from or reach out to me from. If you are thinking of the Maiduguri, Zamfara, if you are thinking of Imo State or Enugu State in the east, if you come to Osun or Ondo State in the west, if you come to Delta State, if you go to Abuja, Lagos, I've had multiple patients from those places, and they reach out because they need help and guidance on this, on fertility, and that is what we do. I'm currently affiliated with multiple fertility clinics across the nation, in Port Harcourt, in Warri, in Delta State, in Abuja, in Lagos. These are fertility clinics that I also work with across that region. And beyond that, we've been involved in the birth of multiple babies, from quadruplets, triplets, twins, to multiple single babies, and even in just regular deliveries, or working with women that are not even going for IVF or any of those things but require fertility support. And what that has done for me, I had a very deep curiosity in my heart. I had a question, and I wonder if I think it's a question you may have had too, and it's this: what can I do to improve the chances of success for patients before they come for the procedure? What can they do before coming for the procedure that can make their chance of having success higher? The thing is that we already know that IVF is not 100% at this point in time in the world. The technology for IVF has not gotten to a point where, or fertility in any way has not gotten to a point where we can give you a 100% assurance of getting success. But I've seen the devastation that a negative IVF result causes. I've seen the tears that patients cry when they have negative IVF results, and I've also seen the tears that patients cry when they have a positive pregnancy result, or they have their baby. I remember a father, he believed, in fact, he said he had given up on the possibility of him even ever having a child before. And on the day I handed his baby over to him, he burst into tears. And that moment is forever etched in my mind, because I could see the difference, that joy that came into his life when he was able to finally see his child after years of believing that this was not going to be what it was going to be for him. And I said, okay, what can I do? The thought came across my mind, so I started calling. I compiled a list of women that had successful IVFs. I got their numbers, I got their details, and I started calling them and having interviews, having conversations with them. I had a question in my mind, and the question was, what did they do before their own procedure? That was what I wanted to know. What did they do before their own procedure? What were they eating? What were they drinking? What were they thinking? What were they saying to themselves? What supplements were they on? All of those things, because we know that this is the protocol for IVF. We know that this is what it is. But I wanted to know, was there anything different that these women did before coming to the hospital or before commencing the procedure that had an effect in the IVF success? As I started talking to these women, I noticed certain similarities, and it was astonishing for me. But when I noticed it at first, because it was not an official study, what I mean by an official study is why scientists, you understand. And what happens is, you cannot just use something based on your thoughts. You want to use a protocol or a procedure when you have investigated it under proper scientific conditions to ensure that this thing is actually correct, or this thing actually holds water. And that is what some of these recent studies are now making me understand, which is that those things that I identified back then as factors that actually improve the chances of getting pregnancy in IVF, and that I consider to be important, are being shown now in recent studies to be very, very vital. In fact, there was a component of these that I noticed was the most glaring thing for me, but it did not seem like I considered it back then and I was ruminating on it, but there was not a lot of evidence to really work towards it then. But the recent studies have shown that these factors can even have a 5 times effect on the success of your IVF procedure or trying to get pregnant in any way. And that is why I want to outline them for you. So after saying these things that I saw, I started going through studies, and I was able to outline 3 major factors that affect the success of your IVF. So we're going to go across them in this way to identify each factor and what you can do in your own end, or how that factor can be modified by you in a sense to give you the best chance of your pregnancy. Being not disturbed, we are going to have a lot of, you're seeing me emphasizing a lot about IVF because that is the major group that this is geared towards. But realize that these principles cut across IVF, IUI, any assisted reproductive technology procedure, or even trying to get pregnant regularly. This is what it is, because this is what these principles are what I essentially went with now for Mrs. Brenda C, who actually happened to be a patient that met me after a miscarriage and was very bothered about the fact that she had been trying for 3 years before getting pregnant and had not gotten pregnant at that time and not been able to deliver a baby, and she needed support and she needed help. I told her, let's work together. If we're able to work together, we will move on from this point where you are meeting me to your pregnancy. And coincidentally, just a few days ago, she delivered a baby and had done a naming ceremony. I was inviting me to come around, but I wasn't able to be around for that on account of work obligations. But I was very, very happy, and I'm still very, very happy for her, because that is what gives me joy doing this, being able to be part of the process and get you to your pregnancy. So essentially, the three things that matter, the three secrets that are going to be impactful in getting your IVF pregnancy is this. Number one, you need to know how you can use successful IVF protocols to do your own IVF or for your stimulation in any way. That is one. The next thing you need to understand is how you can carry out optimal preparation that will increase your chances of pregnancy by 2 to 3 times, or even an extra 30% chance of getting pregnant. What I mean by that is that for some points we've seen that this may have a 2 to 3 times effect of the chances of your getting pregnant, or it can add at least an extra 30% to your chances of getting pregnancy. And finally, how you can identify clinics that will give you good success, good chances of success, and not waste your preparation. Those are the three things that we're going to be focusing on before moving to the IVF financial support and rounding off this training. So let's start with the very first thing, how to use successful IVF protocols for your IVF. And the thing is this, before now, if you think about it, you've heard a lot about IVF failures, right? And if you think about it, with everything you heard, it seems as though IVF mostly does not work right. You see, but that is not really true. What it is that it's a suspicion that you may have had before. Have you ever thought about when you wanted to go to a hospital for IVF or some facility, and you think, it's possible that some hospitals may have better results than others, or some protocols may be better than others, and all of those things. You've had that thought, right? You've considered that and maybe even asked about different hospitals to see which one has a good protocol, right? The reason is you are right. The protocol actually matters and varies to an extent across hospitals, and this can actually affect your success. But the inherent thing you should know is that the IVF procedure works. For example, the oldest IVF pregnancy in the world right now is for a woman that is how old? Do you have any idea what the age is? You can take a guess. Maybe think about it, and I want to give you the age. You can see if you're right. So the oldest IVF mother that we have currently in the world that is verified is Erumati Mangama, who gave birth to twin girls at the age of 74. And why is this important to you? It's because you should see that even the age factor does not mean that IVF will not work. If IVF can work for a 74-year-old woman, how about for you? But that is not just her own case. We have for Safina Namugwaya, who also gave birth to twin male and female children at the age of 70. And we have other mothers who gave birth at the age of 64 and thereabouts and all of those things. We have a lot of ethical considerations for you doing IVF at this age. There's a question of how would the mother be able to take care of a child and all of those things. So generally, we don't do IVF for those ages usually under regular conditions. But the thing is that there are protocols that work. And the oldest IVF pregnancy was from a woman in India, right? And even within our own center, this is a lady that came in at the age of 55 now. Let me confirm something about her name. So she came in at the age of 55. Sarah V. She came in at the age of 55 after being menopausal for multiple years, had in fact she felt like she was not going to be able to get pregnant again upon the face of the earth. But after going through her procedure, she was able to get pregnant. I'm about to see no man get pregnant at the age of 56. So what this means is that there are methods that, and that is one reason why the clinics I'm affiliated with are clinics that I have done personal reviews of. I've been I've done personal reviews of. I've seen them, I've ascertained how they navigate their procedures, and I can see that they are quite efficient. For example, this patient now that we're talking about is 55-year-old, 56-year-old at the next IVF she did because she wanted to get pregnant again, was because was her husband was 60 years old. She had been without a pregnancy for 27 years, greater than 27 years actually, before finally getting pregnant via IVF. And one of the reasons why I work with some of the doctors for example, one of the doctors who are working with now, he had his training in India as well, which is one of the centers. There is the center that the country that has where the oldest IVF pregnancy was successfully achieved, right? We have a professor of infertility. We have one of the most certified doctors across the nation involved in trainings for Association of Fertility Doctors. Is one of the most certified. These are the kind of people. Why? Because you know that one of the factors that will actually affect your IVF success is going to be where you do it and how it is done. Everybody's competent. All doctors are regulated and competent. That's not what I'm telling you now. They're regulated and competent, but protocols slightly differ and they matter too. And sometimes what may actually be required is a personalized approach to you. So an individualized protocol may actually work best for you depending on what's actually going on. So pay attention to that when you are trying to get into your IVF. Then the next thing that you should consider after that is that IVF is not actually 50-50. I know you've been told that IVF is 50-50. That is the chances for IVF success. That is highly untrue. The thing about IVF is that, okay, let me give you an example of a particular patient now who is 50 years old, came in for IVF under regular conditions, should have been told that her chances of success are very slim, right? She did a singular IVF, first time procedure, got pregnant, and delivered a baby girl. What does that mean, and why is it important to you? What it means is this: the chance of IVF success is actually highly individualistic. Highly individualistic. And what that means is that despite the fact that we may have standard estimation methods or say, oh, this is what it usually goes, nobody upon the face of the earth can give you a prediction as to what your chance of IVF success is. And in this chance of IVF success, some persons may be laying at being 60%, 70%, or 80% chance of getting their pregnancy. But because of the fear that has been existing about whether IVF may work and all of those things, they may find it very difficult to go for the procedure, not knowing that they are among the group of persons that will come in, do a singular procedure, and actually get pregnant. So it matters like that. Another thing about pregnancy that you should realize is that it takes two to make a baby. So it depends on the quality of your husband's semen and all of those things and his own optimization and your own. So somebody may have okay, let's go. There's a lady now that how old was this lady back then? Let me confirm my age so that I can tell you precisely what it is. So okay, she was about 46 years old. She was about 46 years old at the time whereby she came in for IVF. What happened? Her previous partner had been very reluctant about the whole procedure, was very unsupportive, and in fact, their marriage ended on account of this because of inability to get a child. So, luckily for her, somehow, some way, over the next year, she was able to get another. She had another partner, and the partner, they were having a conversation. And the conclusion that they had was it was only after she got pregnant that they were going to get married. And he was available and willing to be involved in the procedure. She actually went through a procedure, got pregnant, and they got married. Invited us for the dedication for the marriage ceremony, and luckily for us, it was a day that we were available. We actually graced the occasion, and we were actually there. And what is this trying to tell you? Your partner matters. Your partner can affect your success. And when we start discussing some of the optimization protocol, you understand what I mean by that particular statement and how it can affect your chances of success in your procedure or even getting pregnant at all. So some of you may be sitting on maybe 80% chance of success. Some of you may be sitting on maybe 40, some may be lying on the 50%. But every estimate that we give is simply an estimate that cannot, no matter how it is, predict the truth about your own fertility chances. Some people going for IVF and come out with quadruplets, some have triplets, some have twins, some have a singular baby. Some do not have any at all. Even though they go through the same procedure, even though they have the same diagnosis, even though they are of the same age, they can have difference. So the only way to know where you are is by going yourself, going to do your own IVF. Yes, on average, you can see we've had cycles whereby within our clinic, like I told you, they have efficient protocols where maybe everybody even gets pregnant in that particular cycle that is being done. So you can presume from there and say it was 100% chance of success. But don't be bamboozled by those things. It is individualistic. The fact that a cycle may have 100%, another one has 80% or 60% success rate, or even for some patients they may have very low success rate, maybe because of the nature of the procedure that was being done for them, not the procedure, but maybe the issues that they had. Very few of them may actually get pregnant within that cycle. That can never predict for you. That can never predict for you. Case in point, 4 women did their IVF recently in our center in Warri, and 4 of them got pregnant. But it's an individualistic experience. There's no way you could have told them than giving them that assurance that they will definitely get that. Then the next thing that is also there, which is a very unpalatable aspect of this IVF thing, is that I know that most people don't want to hear it, most people don't like to hear it, but it's a ground for me to tell you everything you need to know. Whether you want to work with it, you don't want to work with it, or no, that is for you to make your decision, right? Okay. So one thing about IVF is inevitably, what we know for sure is that the more, if a particular cycle, what do I mean by cycle? What we call cycle in IVF is that from when you start taking your medications to when you transfer the baby into your womb, that is a cycle, and the different steps that are involved there. So an IVF cycle ends at the time whereby, an IVF cycle rather, ends at the time whereby you have gotten to that point of the babies have been transferred into your womb. Then 2 weeks after that time, the pregnancy test is done to see if if your body took the babies that were transferred into your womb. On account of time, we cannot go into the full explanation of what IVF is and all of those protocols here, but no problem. But that is just a summary of what that is. And this, we've seen that if somebody comes in and does a cycle, let's use a lady now, a case point. This is a success estimator here. So in her first cycle here, we can see that she had a 60% chance of success by estimation. But remember that nobody can categorically estimate. These are just using maybe word statistics and all those things to just postulate. But nobody can tell you. Nobody can tell you. So this was a 60% that she got, right? And if she were to do, by estimation, if she were to do another cycle within that same year, say she not get pregnant within the first year, she will increase her chance of success to 78%. And generally, again, if she were to do a third cycle within that year, she will move from 78% chance of success to an 86% chance of success. Why? Think of it like this. Think of it that the body stacks the procedure and gets more fertile. Think of it like that. More fertile with subsequent procedures, especially when they are done within the same year. That is the reality of IVF. That's the reality. No matter what anybody says, that is the true reality that actually exists. So sometimes it may require more than a single procedure to get pregnant. And you also have to be prepared for this possibility and this option, despite the fact that it's not what we want for you. And the major purpose of being able to, of having this conversation now, is so that we can avoid that. That is, increase your chances of getting your success within a single trial. So put your body in a state that makes you very susceptible to getting pregnancy, and then come for your procedure. That is that. Then the thing that you should know is that what is now possible with all of this information that you're about to learn. What's possible is that you can now walk into your IVF with more confidence and without anxiety, without fear. You can prepare your body and optimize it between now and the next 30 days and still actually increase your chance of success. If you have even started your procedure within now and they started your medication within now and the end of that time, which will take about 30 days plus and can take up to 6 weeks more, you can still optimize your body. There are things you can still do. Then if you are very far off from doing your procedure, maybe you are planning to do it in like a year or in 6 months, it's even better for you because that will even work best. It will have a lot of time to prepare your body for this procedure. And because of this now, because of these new innovations, we have more chances of success and more success stories coming around for you to get your pregnancy. And I know you have planned to do IVF before. You have been planning to try to get pregnant. I know that you've probably gone online, right? You've checked online for what to do. You've seen some information. You are not sure if it's actually, some of them you are not sure if they're actually working. Some you have been trying to do them, but it's confusing, right? Even may have almost started some things and stopped doing them because of lack of effectiveness or something and all of that. You have had that kind of this thing, right? But what we're trying to do now is give you the things that are research backed. It's not, they are not suggestions, they are not thoughts. They are things that research has shown us that these are the best approaches for now. Maybe we'll go to another point later in the future. But as of today, in this moment, these are the best things you can do to improve your chance of getting pregnant in your IVF. So, one thing you should know is this: if you want to actually achieve success in certain things, sometimes it's easier to ask somebody that has done it. Think of trying to learn how to drive. Do you just go there, pick your key, get into the vehicle you've never driven before, and start driving? You're going to kill people and you're going to kill yourself. You have to either observe somebody that has been driving, read books on driving. Let me just even say that most people you have to observe, or go for a driving, or get a driving tutor. And at the end of the day, before the government will still place you on the road, what do? They take you through tests to ascertain that you have actually learned, so that you have actually learned from your instructors and all those things that you've done how to drive, so that you are not a nuisance on the road. It's the same thing for IVF success. There are crumbs that have been left by success stories to let us know that this is how we can actually go through it. And like I told you about how nobody can give you success, I had a patient who was a very, very inspiring story. Very, very inspiring story. In fact, her story was very spurring for me. Why? She had been to, I know some of you may have been to multiple clinics, right? Where you've seen one doctor here, they've said this, you've seen another doctor there, they've said this, and all of that, right? Now, for this lady, she had not just been to multiple clinics, she had been to multiple countries. The UK, I think the US, was it Switzerland or so? She had gone to these places and they had told her that, see, I think it was Austria. And I told her that your chances are, it's unlikely that you're going to get pregnant. In fact, they had a back and forth and ended up not doing it outside the country because they felt like it was not looking too good. But this lady found optimism. She did a lot of research and was able to find optimization techniques, right? And she did this thing. She followed these things, followed diet plans, exercise plans, resting plans, all of those things. Did everything. And when she went in for IVF, she came out with triplets on her first trial. This was somebody that was even told that she had a very low possibility of getting pregnant. You understand? And I've been to different countries and I've gotten that kind of report. Came back to Nigeria, did that procedure, and she got pregnant with her triplets. So, the point is, you too can get pregnant too. You can do your best to improve your chances and not be carried away by negative reports. So, the first research we're going to be looking at is this. This is before we go into the research, let's start by identifying how we're going to navigate this thing. So there are going to be 3 steps involved in optimizing yourself. There are going to be 3 steps involved. The first step is that you need to identify where you are. Before you can make any form of improvement or make any form of modification, you need to know where is your body currently. That's what you need to know first of all. Then after knowing that, the next thing now is to follow these different aspects of life optimization That's the next point that you're not going to go through. You follow the different aspects of life optimization, and then finally you can now go in for your procedure to see how you can actually get your pregnancy. That's how it's going to be. So step one, knowing where you are. This is where, if you are trying to get pregnant or you're planning to do an IVF and you've not been to the hospital, you've not started the optimization process. Why? You need to know where the problem is coming from first. So tests, scans, reviews, this needs to be done. Then you should also know even your BMI, that's your body mass index, which allows us to know how big are you in relation to your size. The smaller you are, the shorter you are, the smaller your size should be. The bigger, the taller you are, the more leeway you have for weight. Because we've also seen how this affects IVF success. Then, how is your diet? I usually recommend that you monitor your diet for about 3 to 5 days, taking note of what you are eating. If you want to take a record, you can take a record. That's very good. So that you can now identify what is my current diet pattern. What is my current exercise pattern? How often am I doing exercise? What am I doing? When you know where you are, then you can now move to step B. So first, medical optimization and identifying where you are medically, physically, psychologically, even all of those things. Because even your mental aspect is very important in IVF success. So you can take a checklist, a mental checklist, and see where you are mentally. Because the truth is this, one of the things that touched me a lot, that really hit me a lot, was when at about 12 midnight, one of the days before, I was on my phone. Usually for my patients, I'm usually accessible. So if I'm around, if I'm not working at the time, I'm not occupied with work at that time, and I'm on my phone and they send a message, usually I would respond so long as it's one of my patients, right? And she was bitterly pain and crying. Bitterly pain and crying. What was the issue? It was because of this fertility issue, this fact that she had not gotten a baby. Have you ever had a time whereby you were very devastated and in pain over the fact that you've not gotten your child? Have you ever had a time whereby you cried on account of this thing, or you had an issue and somebody said something that was so painful? Which was the case with one of my patients as well, who I'm very happy for. She's pregnant. She has given birth to her babies now. Nobody can insult her like that anymore. Over a line, a rope line. You know, rope lines that you put outside at the back of your house so that you can hang your clothes, right? She put her clothes there. Somebody came in, a neighbor, because it was a house that had neighbors, came in and shifted her clothes, and some of them fell and all of that. She just very calmly came and was trying to talk to the lady. And why would you do that? My clothes were there. Next thing was something about how she that does not have children, why does she need that kind of rope line? It's annoying, right? What makes that? Why is that the next point if not for maliciousness? This lady cried. She cried. So same thing with this other patient who was crying in the middle of the night and telling me how her marriage was at stake at this point in time because of the fact that she had not got, her husband is saying he's going to walk away if she's not going to get pregnant and all of those things. She was devastated. In fact, it's a very painful thing. It's a very painful thing. So that's why we do these things. Now we can we can end and stop all of these things. All of these things. And the society can be so terrible sometimes. I've heard people call patients, not even one, they will say they are men because they've not gotten pregnant. Or even a man who was having issues with his sperm, and the lady she actually left him at that point in time. She left him at that point in time and did not just leave him but humiliated him. He had to move out of where he was staying before to a different area out of the level of shame that came up, because she said it very publicly, shared it out, insulted him outside. People started mocking him with it. He could not stay in the area anymore. These are very, very terrible things. I'm quite passionate about my patient. I'm sorry. It gets to me a lot, all of these things, how people are made to go through this kind of pain for no just cause. And they are doing their very best to get out of the situation. But anyway, so the first thing is know where you are, know where the problem is coming from, know how you are mentally, physically, in your diet, medically, and all of those things. And that will give you a picture as to what is the best course of action. Then the next step now is to follow your body optimization before the procedure. That is step 2. Follow your body optimization before the procedure. So what do I mean by that? There are different points across which you are going to optimize, but we're going to start our review with the mental optimization, your mind, your mindset revamp. And usually you may think to yourself that what does the mind have to do with IVF? So it's not just to go in, do my procedure and come outside. How does it matter what I'm thinking? How does it matter how my mind is? Well, let me tell you how it matters. There's a there's a male here. Is a There's a man, this man that I'm going to be displaying at this point. He's a 27-year-old man who was involved in a study. I don't know if you know how studies work, where they are trying to check if, let's say, paracetamol works very well. And what they will do is that they will give some people the medication, they will not give others the medication. So they will not tell the ones that are not taking the medication if they are on the medication or not. Why? They want to know if the drug actually works. So those ones that are not on the medication will be asked to answer questions. Are they still feeling the headache, for example? How many minutes after they took the medication did the headache stop? Are there any complaints after taking the medication, as well as the other group? If the people that are not taking anything don't have, if people that are taking something don't have a better result than people that are not actually taking it, they are giving what can be just small sugar pills or sorts, just think of it like shocky pills. If they don't have a better result, we say that that drug is not effective. So this young man, 27 years old, was actually involved in this kind of study, but it was a drug for depression. And he did not know that he was in a group that was not taking anything. I think he was taking some sugar pills at this time. He did not know. He started taking the medications, and then he had an issue with his partner, his girlfriend at the time. He felt very suicidal. You know how it works. How some people can, this can be very depressing and sad, right? So he decided to end his life and took some pills. After taking these pills, immediately started feeling very terrible, started feeling very bad. His heart rate started beating very fast, his blood pressure started becoming low, all of this started happening to him. He was feeling very weak and dizzy, and they had to rush him immediately to the emergency. When he got to the hospital, the doctor started attending to him. For about 4 hours, they were trying to get his blood pressure up, it was not working. They gave him IV fluid, about 6 liters of fluid. And what 6 liters of fluid is this. In your body, you have about 5 to 6 liters of blood as an adult. So they essentially replaced the volume of blood that he had before. Not replaced now because that one was still there. Added another 6 liters, made it times 2. This man's blood pressure was still low. His heart rate was still high. They had to start, but they did not know which antidote to give him. So they had to contact people of the study and say, okay, what drug were you actually giving to this man that he has taken an overdose of? Only for the doctors to inform them that no, this guy, we've confirmed, is in the group that is actually taking nothing. There is nothing in his medication. He should not be having any reaction at all. The doctors came back. These are the doctors that have been fighting for about 4 hours to ensure that this man stays alive. They came back and told him, within 15 minutes of being told that the drugs he took had no effect, he got better. And this study became very important in medicine because it made us realize that what the person is thinking and the brain is telling them can affect every medication that you are giving. You will not get success. And that is one of the effects of what the mind can do. But let's say that now that is just a random occurrence that actually happened to this guy let's just say it's a random occurrence that just happened to this guy. Let's see how this mind effect can be in IVF. So the first study we're going to be looking at is what we call mindfulness-based stress reduction. These are meditative or how do I make it? Mindfulness-based stress reduction are multiple modules of courses that a patient goes through before going for IVF. Usually, we prefer that they go through them over some weeks, or before going for IVF, coinciding into the IVF procedure and all of that. So they did a study of this. This was a study published on the 4th of May 2026 now, for online mindfulness-based stress reduction studies. So the studies, the courses were given to them online. And they found out that the people that went through this procedure were 2.5 times more likely to get pregnant than the ones that did not. So the ones that did not go through this procedure, 9 of them got pregnant for that particular cycle that they did. But the ones that went through this program, 22 of them got pregnant. So 250% increase in chances. So the person that did not go through this program had already reduced their chance of success by over 50%. Think of the number. 9 got pregnant in this group. The other group had 22 of them getting pregnant. 2.5 times more. So it's very impactful. But let's say that maybe it's just this person that had this particular result. Let's look at another study here. Effect of health promotion lifestyle education on the treatment of unexplained female fertility. So what this one simply means is that they did this health promoting lifestyle education. They try to give them navigate, show them like what they can do, how they can walk through their minds before the procedure. And what they found out here was that they had a 2.4 times higher chance, over 2 times higher chance, almost 3 times chance of getting pregnant if they were going through this procedure versus the one that did not. In fact, it was so bad in this particular study that for the ones that were going through this, 46.1% of them got pregnant in that particular first cycle. In the second, but the people that did not, only 19.2%. So here you have almost 50%. Here you have about 20% of them getting pregnant because of the way they selected this particular group of persons. That's to show you the effect that these programs can actually have on IVF. They did another study on an internet-based, this same mental and mind modification studies, right, for women experiencing infertility. They found out that pregnancy occurred earlier and more frequently along the ones that had intervention. In fact, it was here the odds of getting pregnant if you're on the procedure, if you're on the program, were 4.47. That's about 5 times more than the ones that were not on the program. So you understand how important this actually is. It's not something that you should joke with. Preferably ensure that you are actually getting this. Now, there are limitations to why this may not be done in the hospital, because there was another study on what the limitations are. Why are these things not being done? It's because of the okay, maybe at the point whereby we have gone through the first 3 of them, I will now explain to you why it's difficult to get this service in the hospital directly. And one of the studies that was done was, okay, wasn't one, but multiple of the studies that were done actually, we are done with comparison against normal IVF procedures whereby you come in, your doctor does a counseling, or you do 1 or 2 counseling sessions before you do your IVF, versus you go through the program. And what they found was that going through the program had this increment in rates of pregnancy versus just doing your regular IVF procedures and just doing your regular counseling with your doctor. Okay. In fact, one of the studies that was very, very eye-opening, one of the studies that was very, very eye-opening was where there were a group of people that they came in for their IVF, they came in for their procedures, right? And after coming in for their procedure, they were told to go through this program. But essentially because of the fact that they were not sure what it was, most of them did not complete up to even 10% of the courses. They did not complete it. They were not adherent to the process. During that first cycle, many of them did not get pregnant. It was about a 43% success rate that happened. The second time that they had to come in for a second cycle, because of the fact that many of them did not get pregnant during the first cycle, they decided to come into the second cycle and actually pay attention to their classes. So this time, a lot of them completed about 75% of their classes. They were there for the classes, they were there for the program, they did the exercises they were told to do. And some of them still did not. So they found out that the ones that did not go through it had 30% less chance of getting pregnant than the ones that went through in the second cycle still. So think of how much money had been wasted by avoiding the program in the first place. First of all, they had to repeat it. So they paid the first cycle IVF and then paid another cycle IVF to be able to get it done. So that is why what we're trying to avoid with all of these things is that to reduce your chances of spending too much money and the emotional pain that actually comes with all of this. The major thing that you want to do, there are so that you can do this if you want to do this, there are 5 major things that you are looking at. Number 1 is the idea of you being a trying to conceive mother is not something that is the most amenable state to be in. Think of it. When you're in school, let's say you're in your final year and somebody asks you, oh, what level are you now? I tell you that you're final here you will soon be a graduate. Is that true? And I say, yes, so I'm trying to graduate. Versus somebody else asks you and you say, oh, I will soon be a graduate too. Who sounds more confident? Trying to graduate looks as if you are coming from a point of negativity. As if it looks as if you may not actually be able to do it. But you will soon be a graduate has this sense of positive approach. And this is one of the most important things to ascertain when you are trying to work on your mind before your IVF procedures. That you want to go through daily meditation exercises. It works. This is what studies are showing us. This is not thought process. This is not motivational speech. This is scientific investigations. It works. You need to go through daily exercises. You need to go through. You want to sit with the possibility of. So if you want to sit with the possibility of your IVF can work, and also that it can fail, and be at peace with both outcomes. Be at peace with the possibility of the IVF working and the possibility of it failing. That's important. So that possibility of being able to sit in peace with these two outcomes is a very key aspect of success. In fact, it was one of the most prominent things I saw when I started asking those patients about their success and what they did. I saw that the ones that had success were those that they did not do it like a do or die. They had this mentality in their mind that if it does not work, I will keep going, I will keep trying. But it will not be the end of me. So one of the things that needs to be focused on in your program. But at the same time, you need to be going through exercises that will decrease your stress level. Meditative exercises that will make you less stressed, because stress has been found to increase the possibility of not getting pregnant. Yes. You also need to have possibly one of the best things, anticipate success. Now I'm saying that you should be able to sit with failure, right? But now I'm saying you should anticipate success. It looks like opposite, but they are not. They are two sides of the same coin. Despite knowing that IVF does not work, you have to be able to bring yourself to a state of knowing that this can work for you, and sitting in that, visualizing that. I would usually advise couples, even have a time to sit down and think of, sit with your husband or your partner. How would we respond if we have success? How would you respond if we have failure? Be prepared. These are some of the principles that will move you from being a TTC mom, a trying to conceive mom, to a future parent. So you need to move from TTC to future parent to ensure that your body is at the optimal state mentally and in a mindset wise, with less decreased level of anxiety to go in for the procedure, because that can give you up to 2 times to 5 times increment in your chance of IVF success. Now, we talked about when you were starting before, so that's the first thing to optimize, right? Your mindset, and moving from TTC to a future parent mindset. Then the next thing that you want to be looking at this point is actually your BMI. Your BMI refers to your body mass index, which is a calculation of how fat you are. Because let's start with a particular study on BMI now before we go into much into it. So a study was done on over 4,600 women that were going for IVF. And what the study found out was that people that were in a healthy range had up to 68% chances, 68% increased chance of getting pregnant versus people that were in an unhealthy weight range. Now, if you're in an unhealthy weight range and you're about to go for your procedure, there's nothing you can do about it. There are things you can do to optimize your internal milieu. There are the diets that you can be on, or certain things that you can start eating, which we are going to go to next. But that was what this study showed. Imagine leaving 68% increased chance of success on the table because of the fact that you don't want to go through some of all these procedures or all these programs. You are now making the chance of you going through multiple IVF increased. In fact, there was a lady that I saw recently that actually had she had had 3 previously failed IVF, because she was very lackadaisical about them. She would just go and get them done. But on this 4th time trial, she said, no, I'm going to do something different. How can I optimize all of this? So this time she was very, very focused all of these things that this protocols that we're talking about now, she ensured that she optimized every one of them for the procedure, even down to not using scented soaps. Yes, on the day you're going for your IVF procedure or around the time you're going to go, don't use products that have a lot of scents in them because they can be very toxic to the embryo. Even we as your doctors, we won't use perfumes when we are going in for to collect your embryo because of how those scents can be very toxic. So she not even bathe for some days before the procedure or after because she don't want to affect the embryo. Now that's serious she took it this time. She's a mother of triplets today. So these things matter. So one is that effect of your weight on this. And the conclusion that we saw was a higher adherence to what we call it usually say Mediterranean diet. That's one of the best diets that is. So for the purpose of this, I'll call it a fertility diet. A higher adherence to this fertility diet associated with increased chances of clinical pregnancy and live birth after. Then let's say that was just one study. You know me, I don't like saying one and naturally that so it's just one. Like I told you before, I've observed it, but I don't feel like that was enough. But let's go into some. Let's see what some studies we should stay. That's one study that has been done that actually supported this view. Now let's say that this study is not good enough. Look at another study that went through adherence to the Mediterranean diet and the for the problem. Let me make it some fertility diet. That's what I'm trying to say. Adherence to the fertility diet and IVF success rate among non-obese women attempting fertility support. So what they found in this situation here now was that what they found in this next study was that the women that were going to go in for this procedure, when they went on the fertility diet versus they were not on the fertility diet, they had almost the same implantation. What implantation is that the woman comes in and after you transfer the baby, does the baby not try to get into the womb and get pregnant? But after that point, the women that were on the fertility diet had 2.7% increase. So that's about 3 times, not 2.7%, 2.7 times. That's about 3 times more chances of actually getting pregnant and the pregnancy staying, developing, and being delivered. So when you hear some women say that, because have you heard that before, that she got pregnant but the pregnancy did not develop? Some of the problems started from this diet. Some of the problems started from there. Assuming they were on a very optimized form of a fertility diet, they can have up to 3 times increased chances of that pregnancy actually developing rather than it not developing after transfer. Okay, let's say that, oh, this one is one. Maybe we heard that this study is because of, I don't want it to be too, there are so many things. In fact, the details of all these diets and all those things, I'm not even able to go into them here because I know that it's going to make it very lengthy. But I'll tell you how you can get into them maybe. So the other one was another study that was done on preconception diets and the association between ongoing pregnancy. That is, before these women got pregnant, what they were taking, how did they actually affect this thing? They found out that same 65% increase that we're talking about, by just moving these women into a fertility diet zone and eating accordingly, they found out that they had a 65% increase in the chance of getting pregnant. And now, there was even a comparison between these fertility diets and normal healthy living. I don't take Coke, I don't take soda, I don't smoke, I don't drink, I take a lot of fruits and vegetables. Is there a difference between this very health conscious and low processed food person versus the person that's actually on the fertility diet? And what they found was that the person that is on a specifically fertility diet, this fertility diet now we're talking about, versus the person that is health conscious, the person is taking a lot of fruit and vegetable, the person taking a lot of fish and legumes, not taking mayonnaise, not taking snacks, not taking a lot of meat products. The person that is on the specific fertility diet has a 40% increased chance than that person on the other diet, than that person on just a normal healthy diet. You understand? So these are things that actually matter. And I don't want you to go into your procedure or be trying to get pregnant without optimizing this thing. So now that you are hearing, would you work on these things? I hope you do. I actually hope that you do. So that is some of this thing that I was actually seeing when it comes to the effect of diet on these procedures. And okay, And that's one thing that you can see. But when I'm talking about diet now, don't go and there are negative diet patterns. If you start trying to, you are going for your procedure very soon, and you're trying to take one extreme diet and just cutting this, cutting that, say in an attempt to lose weight, in an attempt to do this, you are going to put yourself in a negative state. Yes, there are negative diets, there are positive diets. That extreme breakage of fat, that extreme fat loss that you are doing for yourself at this point before going for the procedure, because you're trying to cut your weight, can put your body in a negative state and affect the success of the procedure or affect the probability of you getting pregnant. So it has to be done in a balanced way, so that you don't teach yourself into anything negative at all. Now, what is the next point that we're going to be looking at? I hope you understand. You understand what I was saying. Are you getting me? Are you with me? Are you getting me? Okay. Okay. Now, the next point that we're going to look at is what we call fertility-based exercises. That's the next thing that we're going to be looking at. And for the fertility-based exercises, what you should be seeing here in this particular situation is knowing that exercise, as we all know, you know that you've been told before, exercise, is it good or bad? It's good, right? It's good. Yes. Exercise is very good. But what we have also now seen is that there can be positive and there can be negative exercises. Highlighted here now is a patient that had been having issues getting pregnant. She was a very athletic person, does a lot of running, a lot of going to the gym and all of those things. But she was having issues getting pregnant. After visiting multiple clinics, eventually came to the conclusion that, okay, reduce your level of exercise, because we've seen before now that if you are doing too intense exercises that are too intense, if you are over exercising on the exercising, you have the same effect to affect your fertility. In about a month of her stopping those extreme running exercises and extreme gym exercises and doing just calm exercises, fertility supporting core exercises with moderate activity, she got pregnant within a month. There may have been other factors at play, but that was the major change that occurred around that time. That's to tell you that exercise can be negative. Why? If you put yourself in too much of an extreme exercise state, you trigger a stressful response from your body. And that can now start affecting the chance of pregnancy. So what kind of exercises should you be doing? You can do core strength training. You can do some form of walking. You can do some form of yoga or meditation if you want. Those are some of the things you can do. But do not start doing exercise that will take you to exhaustion. So those are some of the key points you can take for when it comes to the kind of exercises you can do for your IVF procedure. Pelvic exercises are also very good. Pelvic floor exercises are also very good. Then the next thing that you should look at after looking at your mindset optimization, looking at diet optimization, exercise optimization, then we can now look at, very definitely, avoid smoking and alcohol. Definitely take those off. Preferably alcohol as much as possible. Knock it off of your list. Avoid smoking. Caffeine. We usually say you can take up to 300 microgram or milligrams of caffeine daily, but I still say milligrams of caffeine daily. But my best advice is just let it go. Just let it go. Since it's not supportive for your pregnancy and it's not supportive of getting pregnant, because you want to optimize. Think of it now. Imagine that you are the one trying to get all of your optimization in place. Would you want anything that can potentially affect your success to be there? No. So it's best to take it out. Then the next thing you can actually look at now is the supplementation. Supplements that can be used. So I don't know if you've heard about this before. You've heard about supplements now. Maybe take folic acid. They've told you that before. Or you may have heard the omega D3 or coenzyme Q10, all of those things. You've heard about some of these supplements before, right? They can be helpful. So supplements may be necessary. In fact, I had a couple recently, a 46 and 40-year-old. In fact, she told me that for the last, 20 years, 20 years of her marriage, she had never missed her period. Never ever. But after consultation, her and her husband were placed on certain medication, certain supplement, and she missed her period that month. The thing is, what should you take and how should you take it? So, coenzyme Q10, folic acid, omega D3, myoinositol, chiroinositol, selenium, some of those things are things that you can do a research about if you want to do research maybe, and so those things need to be known. We need to know what you need to be on among all of these things. Then another thing that can also be there is drugs. Some people may require certain drugs for their optimization before the IVF. I had a patient, she was about 30 years old, based in the UK, reached out to me and said, Doctor, I want to come back to Nigeria for an IVF. I'm ready, we'll have the finances and all those things. We did a consultation for her online, understood her history, and told her that, okay, I know you want to calm down, but we think that there may be a possibility of you actually getting pregnant before coming down to Nigeria. So placed her on some drugs and some supplements as well. Sent her the prescriptions, told her what to get. She got them, sent the picture of what she got back to me. And we said, okay, she can be on this. It took about, was it 30 days later? Was it within a month or less than 2 months? She actually got pregnant. In fact, she had not come back to Nigeria since that time. The image of her baby that she sent to me she sent it online. She was very thankful and very appreciative about everything because she had been trying for multiple years to get pregnant with no success. So some of these things may be necessary. Another patient, about 37-year-old, came in, she wanted to do a procedure. After doing hormonal, saw that she had deranged hormone. And what we advised her was, if these deranged hormonals are what actually has been preventing your pregnancy, even if you go in for this procedure, we disturb it as well. So take these medications, try to get a better value, and go in for a procedure, which she actually did, adhered to, took her medications, and she has gotten pregnant and has delivered her baby. So sometimes these are what is necessary. Then another aspect of optimization is that you cannot just be optimizing just yourself. Yes, sometimes some men may not be, or some partners may not be very, how do I call it? May not be very cooperative. For example, Mr. Emeka, Mr. Emeka, I met him on the day. In fact, that was the day he messaged me for the first time. The day that they just had a failed IVF procedure somewhere else, and his wife refused to come with him to the clinic. She said she was not ready to be involved in any other IVF procedure. She had a failure before. She was not ready to do anything again. And we kept in communication, kept on encouraging, kept on discussing. Eventually, we did our own preparation optimization, and she went in for IVF procedure. She had twins as at the time we did that scan. Twins. So what am I trying to say here? Sometimes a partner may not be cooperative. You do your best to carry them along. But even if they are not able to go along, you just do your own part. But it's also very good if both you and your partner can both undergo the optimization. It's because studies have shown us that males that are on this fertility-based diet, males that are doing optimally in exercise, males that are doing optimally in their mind optimization, that are on the supplements that they need, that are avoiding alcohol and smoking, reducing their caffeine, and on the necessary drugs that they need to be on. And I've gone through medical optimization. I've been medically checked to see if there's anything we can medically optimize for them. Have a higher chance of success in their procedures or in getting pregnant without even IVF than the one that is not available for any of these things. So those are some of the facts that we have right now to actually improve your chances of IVF. Then there's also spiritual optimization. I am a man of faith. Good and fine. That is one thing that is there. However, recent studies have now made us understand that people that have faith, be it the Christian faith, the Muslim faith, or whatever kind of faith, even Buddhism, Taoism, their bodies are in a better optimized state than people that do not. So I advise as well, if you are trying to go for this procedure, do not abandon your faith. Have even more faith now that God will come through for you, that your procedure can work. Have even more faith now that your pregnancy will come. If you are not going for IVF, have even more faith now that your pregnancy will come. See, this is important. It improves your health. It puts you in a better mental state. It helps you to be able to go through your diet, your exercise, your supplementation, all of those things, your drugs. It helps you to deal with a positive or a negative result. faith, spiritual optimization is also important. Do that if you can. By the time you add all of these things together and optimize the different areas, do you think it will be possible for you to get your pregnancy too? Following what these studies have shown us, do you think that you will have an increased chance of success or not? You see? So these are some of the things that you have to pay attention to when you are trying to go in for your procedures. Then monitor. As you have done all these things, you can have a review and know in what direction, if you're actually improving and all of that. Hmm? Then the last secret that we're going to be talking about the when it comes to how to get your success, like I told you before, is choosing the right clinic. Okay, let me see. When when I started my research on this IVF success, right? At that time when I just got into this, people had a lot of negative stories, a lot of negative stories. It was until I started connecting with the professors for infertility, connecting with the doctor that trained in India, connecting with the most certified doctor in Nigeria, one of the most certified doctors in Nigeria, most trained doctors in Nigeria, both in and outside the country, and even having embryologists that we work with, that people fly to come and help them set up their clinic, that people call for consultations and they pay their flight ticket and pay their consultation for them to come and improve their own processes, to train their embryologists and all of these things, was when I started realizing that here you go, who does it? After this optimization matters. So for me, the way I optimize for my patients is I connect them to people that I know that I can trust their results. People that are getting a very good result. That is what that was is how I navigate ensuring that this their optimization is not wasted. So for you, if you cannot visit any of our affiliated clinics, then you can actually they are in Abuja, Port Harcourt, Warri, Lagos, and Enugu. Those are the 5 centers that we have for sure for now. So if you cannot visit any one of them, ensure that where you are going to is properly optimized. Properly optimized. So that, and you also want centers that are able to be at the forefront of advancement. So I will mention some things there that you may not know the meaning. Don't worry, this is for your clinic to know. So talking about PROP, COQ10, hysteroscopy, embryo adoption, FET transfers, ICSI transfers, PGTAs, PGTS. These things are things that your clinic should be at the forefront of, so that they can give you the best chance of your success. Even assisted hatching is only one of these things, right? So that they can give you the best chance of success. So I think I don't want to go beyond, to go too far, but we've already spent about an hour now, and we've been able to at least touch the major points. I mean, by now you should know that one, there are IVF motels that work and that exist outside the country, within the country. Two, you should have learned how you can actually prepare for your IVF to increase your chances of success by 2 to 3 times and even 5 times, or at the very least 30% increase in your chance of success. And you could have known that you can connect and finish optimization, and it's important for you to go to experts that can actually grant you success. And like I asked you before, if you add all these things together with the way they have increased success rates across multiple women, multiple studies, multiple reviews, do you think can increase your own too? So research has shown us that it can. IVF is not 50-50. Where you are going to be, your own percentage is going to be, nobody can tell you. But even wherever you are, if you add all of this preparation on top, you will go far. You will go further than what it actually is now. And by a 44-year-old woman, 44-year-old woman, come in a minute. 44-year-old woman, she was her name then. Let me try and confirm. Sorry, I want to not exactly but let's call her Suleyat here. So she was 44-year-old, had a baby before, because she was about 40 years in marriage at the time she did that procedure. She had a baby before. That was about after the first period, was it the first year or so? But the boy fell ill and died. So she eventually decided to come in for a procedure after 11 years of trying other methods and was not getting any success. By the time we did the embryo collection and all those things, what we saw was that she essentially had just one good embryo. In fact, it was not looking like it was going to be enough. When we were watching the development, it was not developing to the best form, but that was the only one that was developing among all of them. So transferred that embryo into her womb. And today now, a baby girl is born. A baby girl is born. So what I tell you is that is highly individualistic. Highly individualistic. You cannot tell. And that's why you should do your own and see what it is and all of those things. Now, I have a question for you. I have a question for you, and I don't know if you can just think about it for some time. Just think about it just now on this training. What if you modeled these things that are working? All these things that have been shown to actually increase your chance of success. Do you think that your own chance of success will actually not be better? Do you think it will be better? So let's say that peradventure you actually model these things, you follow it, and you now see and do it. Oh, there was one thing I wanted to add. One of the ways of actually increasing your chance of getting triplets or twins is the number of embryos that are transferred. So some countries have low limitations. I think Norway they use 2, in the UK they use 1. In Nigeria, you have the opportunity of being able to, if you have enough embryos, you can transfer up to 3 babies for you. So that usually will increase your chance of getting, it increases the chance of multiple pregnancies. But the older the woman, the lesser the number of babies you want to carry, because you want to transfer, because the more the pregnant, the more the babies, the more the risks that come with that pregnancy. Now, what do I mean? These are regular pregnancy risks. I'm not talking about, say, IVF pregnancy. IVF pregnancy is a regular pregnancy. The procedure that you need to take at the end of the day are not different. Anyway, these ones are going to be something I will probably discuss when we're going through the IVF masterclass and discussing IVF itself because of the time constraint. But the point is that in increasing your chance of success, the more embryos are transferred, the better. However, when you follow this kind of programs and this kind of procedure, you increase the chances of how many embryos your body can take and increase the possibility of proper development for your body. So now, let's say that instead of now getting triplets, after you follow all this thing, you were able to get twins. Is it a bad result? Is it not a good result? What about if it was even just one baby that you got? Is it not also a good result? You've gotten a success, right? So how would you feel actually if you're able to follow these things and you carry your pregnancy? I remember one mother that was on my neck. After trying to get pregnant, she finally got pregnant. And her husband saw something. And I don't know if you want to feel something like, you want to experience something like that, right? All those cravings that come with pregnancy, and she said she wants to eat this particular thing. And he said, doctor, come and talk to your patient, come and talk to your patients. But she also, those instead of pregnancy, you also did the vomiting. And she said, why is she vomiting like this? I told her that you are the one that wanted to get pregnant. Now you are there. Now you are there. But the thing is, everybody has it differently. I have another patient at that. And Mrs. Ada was somebody that, pregnancy, they tell you that you gain weight. She messaged me and said, doctor, I don't know, is there anything I can take to increase my weight? Because this is my pregnancy, so I lost weight too. Imagine those kind of experiences. How would you feel if you're having something like that? What about when you come back home and you hear mommy or daddy and the children are there? Or some of you that will now be saying, I don't know why you are disturbing me. You are scattered the house. Which kind of children are these ones? Imagine having those kind of experiences, right? It will be nice, right? Nice. See, and it's very, very wonderful that this is possible. It's possible. Some people will tell me before they say, oh, IVF is so expensive, the cost is so high. I agree, maybe the financial cost is high. What about the emotional cost? What about the strain of people that have had decades, 10 years, 15 years, 20 years, 14 years, 7, 30-something years of not having their baby? What about that pain? Can you equate that pain to anything financial? How much money is enough to wipe out that pain? To satisfy that desire that you have in you to get your own child? That is the true cost. That is the true cost of not having your child. That pain, those thinking, those sleepless nights. And that is why I really want you to pay attention to these things and to ensure that you follow them so you can stop all of these things. You can go to joy. You can go to your dancing. Maybe they call you, I don't know what you want to do, maybe Obebuka, or maybe like my own name, Samuel, which is like I asked of him from God. So those are some of the things. But I don't know if at this point, I know that we've gone through a lot. There are a lot of things. You may even be feeling overwhelmed right now, feeling like this information is a lot. How do you navigate it? So I don't know if I can spend just a few minutes here trying to explain to you a program that we put together that allows us to help you through all of these things and how you can get them done to improve your chance of success. Is it all right? Okay, thank you very much. So the first thing is this. The name of the program is the IVF preparation program. That's what we have put together for you to actually get your success and how we can actually help you go through your pregnancy and get your success. And what the program actually entails is, first of all, we are going to start with what the program actually entails is that one of the first things we are going to start with is your mind. Remember that what we saw in our study showed us that if you don't optimize the mind of your patients, you are going to be making them up to 3 times less likely to get pregnant. And we've also seen that it's not just something that we just tell you go and do. On these studies, what they showed us is that you need to do guided classes for these people. You need to do guided classes so that you can optimize how they navigate through this mindset optimization, and that it is more effective than just the counseling that you are going to be doing in because usually what we do in IVF is that you just, when you come, you get counseled by a doctor. Some hospitals may have even a therapist, you have 1 or 2 sessions and you go in for your IVF. But something that shows us that it's not something of just 1 or 2 sessions. So it's something that involves daily activities, daily exercises, involves daily mindset exercises. It involves multiple classes, multiple training across different points. It's when you hit those different points that you can increase your actual chance of having success. That is what we have seen. That is what we have learned. That is what we have practically noted as well. So what the plan is that if you are going to be part of this IVF preparation program, you are going to get access to the fertility mindset masterclass. And in that class, we are going to be working on showing you, first of all, the science, because if you understand what happens behind, you will know how to go forward. The science behind this mindfulness, how to go about it, will train you on moving your mindset from trying to conceive to being a future parent. We give you meditation techniques that help to calm your stress when you are feeling overwhelmed. And when you are trying to get pregnant, this will reduce your stressful state. We show you coping mechanisms that you can use to correct whenever stress comes up. We'll show you strategies that you can use to remain calm during the IVF procedure, because that is one of the most important points. That point where you are going to your IVF procedure, maybe you are just about you are going through the period just before you are going to get pregnant. We'll show you those mechanisms. Then we'll also have coaching sessions. In this point, let me now explain to you one of the problems that actually existed in traditional medicine that makes it difficult to give all of these things. I've told you about mindset. You need a mindset coach. You need somebody to control diet. You need somebody to optimize the exercises that you are doing. You need medical doctor that will even be doing normal consultation. You need somebody that will optimize your supplements that you are going to be on. Now, if we're adding the spiritual components to things, you need somebody that will even lead the prayer or read prayer and spiritual optimization for these people. Imagine how much it will cost to now employ each of these persons and have them running this program concurrently in the hospital. And remember that these programs will come on even before the procedure or just as concurrently as the procedure is starting. So because of these large manpower requirements and the cost, because if you now get these people on, you need to add that cost to your IVF cost, which will now make your IVF astronomically expensive. So this happens to be one of the reasons why you see that centers are not able to do it. So we said that, okay, how can we make this achievable? So that is why we decided to do something like this that allows you to plug in from wherever you are and come in and get into the program. So we're also going to have coaching sessions. The idea is to have them every weekend or weekly at a destination point. We'll send you information. You can come in and join in the live session where you go through, you get trained on these things that we have mentioned, and you also have chances of actually having questions, asking your questions, having guidance on how you can actually optimize your mind, having guidance on strategies, also having tips on how you can stay consistent. Because it's not just, remember that study that we saw where some people they did just a few classes and then they stopped. They did not get any benefits. It was those ones that completed at least 75% that got benefit from this whole procedure. And the cost of this, actually, the cost of getting this done, the cost of getting the coach involved and having these classes, the idea is to go over about 60 days. So it's about eight classes, because 8 weeks will be within that point. That's about 2 months. Is at a cost of 150,000 naira per session, which if you consider it for the 8 times that this is going to be done, that amounts to, the cost of this particular program amounts to 1.2 million naira. But that is not even all you are going to get, because the problem is that what else do you need? So like I said, you are going to be getting a daily meditation mantra. What's daily meditation mantra that you can be going through every day to reorganize your states and move you from TTC to future parent, and the cost of that is 100,000 naira. But that is not all. We're also going to ensure that we furnish you with meditation exercises that you can do daily for about 20 minutes, 10 to 20 minutes daily that you do. You can do morning and evening to bring your state and keep your body in an optimal state. And the cost of getting that for you is 100,000 naira, which means that the cost of the totality of this particular program is 1.4 million naira alone for just getting the mindset optimized. You understand why it is not available in the regular hospital now? Because imagine this cost on top of your IVF cost. But that is not where it's going to end. The question we now have to ask ourselves is that, what else do you need? What is the other thing that is actually necessary for you to move from point A to point B? So we realize that, okay, what actually needs to happen now is to also help you with the fertility diet. How you can ensure that your fertility diet is optimized. And the first thing we want to start with is, we are going to get you a fertility diet bootcamp that will leave you understanding and knowing how to navigate your diet. You are going to talk the science behind fertility nutrition, the essential nutrition for fertility, and the healthy diets that you can actually go on. We're going to talk about the eating patterns that are fertility friendly. It's not just one particular way that you can go to this. The optimized ways, options that you can navigate to ensure that you are able to get, because it's not just like you must stick to one particular diet. No, it's more of it's even in fact, using diet is just because that is how you understand it. Because the idea is that I don't want you to do a diet. It's to optimize, to not do a diet, but to be in a healthy lifestyle that will optimize your fertility. So we'll also show you what we call the simple fertility plate method, how to organize your plate in a way that allows you to actually be optimized for fertility. Then we'll also let you understand weight loss and management strategies that you can follow if you are going for fertility. Remember, I told you that you should not go through aggressive weight loss except you have distance to your fertility procedure. So we'll show you the strategies that can allow you to lose weight in a healthy way while also going on your IVF. We'll also show you the food and habits to limit. We have practical meal planning sessions and a question and answer session with our coaches as well. And the cost of getting this program done with 8 live classes is 1.2 million naira. That's the cost of this program. Don't worry. I'll tell you what we are going to do for you. 1.2 million naira is the cost of this program. We're also going to give you access to a BMI calculator, so you can calculate your BMI, your body mass index, and know if you need to lose or you need to stay the same. We're going to give you also a meal planning guide. Yes. We're going to also be giving you a meal planning guide that will allow you to optimize your meals. The cost of that's under 50,000 naira. So getting your coaching, your dietary consultation, the diet boot camp, and we give you also a 30-day fertility meal plan. So if you don't want to, some of you say, I don't want to all those science things, I don't want all those class things, I just want to know what to do. 30-day fertility diet meal plan that will allow you to look at it, pick the food that you think works best for you, and you can go and just make it and just follow that plan. and you'll be in the fertility diet. And the cost of that is also another 50,000. So the cost of getting into this fertility program is another 1.3 million naira. In addition to the previous 1.4 million naira cost, that comes to a total of 2.7 million naira. That's what you'll be getting in this program. That's the cost of this program right now. But that is not even enough, because if we just optimize mind or optimize diet, we've not done anything about your exercise. That will mean that we are leaving some percentage of success on the table. So what did we come up with? So that, okay, we are going to do a fertility exercise training, and the cost of that training is 200,000 naira. We are going to get fertility exercise coaching to come in to coach you through fertility exercises that you can actually do, principle of exercises that you can follow, exercise modalities that you can actually do in your home, or if you need to go out, how you can do it, exercises to avoid or even modify if you must do them, recognizing the symptoms of overexertion when you are doing your exercises, so you don't tilt into that negative exercise point. We are going to get you expert tips on consistency as well, and of course, question and answer sessions are going to be readily available, so that if you have any questions, you can meet in those sessions and ask your questions. And the cost of getting this across to you is another 1.3 million naira, bringing the total cost of this program right now to 4 million naira in what? Now, remember I said that is not all. We want to do full optimization. I know some of you may not even think that it's possible for you to get, but that is the same way it was for Mrs. Julie. And what it was for her is that she felt like it was not going to be possible. She will never have believed it. She will never have believed it. She was thinking that, it's not possible for me. It's not possible for me. After everything that has happened, I don't think it's actually possible for me to get pregnant. I will just have to live my life knowing that I can. In fact, let me tell you what it is. Just listen to her video.
Okay. My name is Mrs. Julie Onoro Delcioko.
So, how did you feel when you got your diagnosis, and what was your issue before now?
Okay, my issue was lack of, for years, it's already menopause. Let's say it's already menopause, because I wasn't seeing my period anymore. I tried other drugs, herbal. I sent for some in Benin, some, even my sister that's in UK brought some, but no way for me to my flu to start. So I later just gave up. I say it's like having children is not for me anymore.
Then, at this point, after listening to our video, what the next thing that you should do now is see our endpoint. This is a wonderful occurrence. Sorry, don't call me. Welcome, sir. While we waiting for you for Sisu, everybody, as we are not seeing you, say, where are you? This is the person that I did not believe before, right? That she could get pregnant. And this is how she ended the story. So, you need to optimize everything. You need to optimize everything so that you can actually get. So, on that thing that was there, remember, we'll talk about fertility supplements. So, we're going to do a fertility supplement masterclass so you can understand the different supplements and know exactly what are the supplements, what are the core supplements for women, what are the core supplements for men. Which one should you use? Don't just go and take anything because everybody said that they are taking it. So people have taken certain medication and they have altered their hormonal system. In fact, it's those medications that their neighbors said work for them that they took that put them in problem. So once you understand the supplements and which one you should use, once you also understand the supplements for male fertility, and we also want you to understand how you can actually take all of these supplements. And the cost of that masterclass alone is about 200,000 naira. The cost of supplements, because our plan is to also be there to review your supplements, so I can tell you what you should be taking. It's 50,000 naira. Supplement prescription, 50,000 naira, which means that the worth of this particular program already is already 300,000 naira. And then when you now add the full supplement masterclass and the coaching support that is available, that comes on that 500,000 naira, which means that this fertility aspect of the program will come out to 800,000 naira, and the total worth of your program now that you'll be getting is 5.1 million naira. But that is not all. Like I said, we sat down and said, what do you absolutely need for your success. Everything that you need for your success is going to be encompassed within this program, so that you can go in with confidence, knowing that you are standing at the maximum, that you have brought your body to the you will like that, right? Don't you like the idea of knowing that your body is at the maximum state of chance of success that it can be in, that you have optimized everything? Would that feel good? Would it feel great to know that you have your highest chance of success when you are going in for your fertility program, for your IVF, or when you are meeting with your husband? Well, we also want to give you access to results review. So if you've done your results before and you are part of the program, you can send it across. We'll help you review it. If you need new results, we'll tell you the tests that you are going to do. Medical consultation is going to also be available. So we are going to have doctors available to actually answer your questions that you have, your medical questions that you have, and if it's necessary for you to actually get some medication, we'll make those prescriptions for you. So this brings an additional cost of about getting this availability for you through this program is going to be, in fact, we decided to just peg it at about 250,000 naira, because this is going to be available for you. So that means that the worth of what you are getting now, can you see what you are going to be getting? So you're going to be getting the fertility mindset masterclass, the fertility mindset coaching, the medication mantra, medication exercise. You're going to get the fertility diet bootcamp. You're going to get dietary coaching as well, fertility diet coaching. You're going to get fertility diet consultation. You're going to get BMI calculation. You're going to get meal planning guide. You are going to get 30-day fertility diet plans. You are going to get fertility exercise training, fertility exercise coaching, fertility exercise consultation as well. If you want to have a expert gym coach there, premium gym coach there for you to get your exercise, you are going to get 30-day exercise guide on your exercise that you can do. You are going to get a supplement masterclass. You are going to get a supplement review. You are going to get supplement prescription. You are going to get consultations for your supplements as well. Now you're even going to get results review and medical consultation as well. You are going to get, in fact, we're also going to be adding an IVF training course. If you don't understand IVF and you want to understand IVF, there will be an optional IVF training course that will be available for you to go through to understand the IVF process, understand what you are going to need to do in IVF, what you need to expect, and how IVF actually works, so that you understand the procedure you're actually going for. You're also going to be getting, in fact, these ones are actually priceless. We could not even put a price on it. So what this means is that we are going to help you connect with optimum premium clinics that we know that their procedures are standard and they have wonderful success rates. So we are going to be getting you in connection with all of these clinics for optimum results. We're also going to ensure that you have support throughout the IVF procedure. In fact, I had a patient that they reached out to me. In fact, like the man I was saying, they reached out to me. It was about that day. They were very bothered. They were confused. They got to the clinic. They were not sure what they had been told about, what they had been told. They were able to call me, and I had a conversation with them. And even beyond that, we also have liaison with all the clinics that we're affiliated with. So when they get to the clinic will give us feedback on what is being done for them. We follow up for them. We act as intermediaries where necessary. If they need our input, they need us to discuss with the doctor, the embryologist, or at the forefront of it, so that we can follow their case files, follow their cases, and ensure that they are getting premium care. It is a priceless support. You have premium support. It's priceless. You cannot even put the cost of what that does for you. Then spiritual support as well. For now, at this particular moment in this time, what I have for the spiritual support is the Christian spiritual support. So if you're a Christian and you need spiritual support, well, this is an optional aspect of it. There's no fee for this. That's also available for you for the duration of this procedure. So that is available for now. Maybe later we'll make also the one for Muslims available, so you can have that spiritual support throughout this procedure, because it also matters. But the total worth of what you are going to be getting now is 5,350,000 naira. Now you understand why your clinics don't have this, because if they were to add this kind of detailed support, then what you are going to experience is that you are going to have a high cost for doing your procedure. That's what you are going to actually experience if you were to have the details of this support. Then we now had to find a way to actually see how we can navigate. Obviously, we don't want to charge you 5.3 million or approximately 5.4 million naira for this procedure, because like we said, this is meant to be something that supports you through your procedure. So what we thought about was, we we said that, okay, how do we make this work? How do we make this work? Because we've seen one thing before, which is back then when the current president of Nigeria came in, there was some economic instability after the removal of subsidy, what we call fuel subsidy, which was a way of cushioning the economy. So I don't know if you remember it, right? Where prices of things kept on going up. You check the price of something in the morning, by the time you come in the evening, the price has increased. It's no longer the same price, things were like that. And we had to have reviews that time. I'm a man of, I believe in scientific evaluation. So we had to review certain protocols and realize that if we say we want to reduce the quality of what we are doing to make it more affordable and get, let's say, lower quality drugs, or normally, let me not say lower quality drugs, different branded drugs from the ones we are regularly using, what eventually happens is that you make your patient likely to do the IVF procedure twice or do the fertility procedure twice. And think about it. You are supposed to pay 1 naira. Okay, maybe say you're supposed to pay 5 naira to do it. But when I say, oh, let's reduce the money so that it will not be too expensive, and let's so that you can pay 3 naira 50 kobo. And you do it because of the reduction in the quality of what you are doing. You now have to do it again. Instead of spending 3 naira 50 kobo, you now spend 7 naira. Which one is more expensive? The double trial, right? So we realized at that point in time that we cannot compromise quality on account of cost. So we want to also always ensure that what we are doing is quality. And that is why I want to ask you a question again right now. If you did all these things, add all these supports that we are talking about, you have the fertility mindset masterclass, you have the mindset coaching, you have mindset consultations, you have medication mantra given to you, meditation exercises given to you, diet boot camp, you have your diet coaching given to you, you have your dietary consultation given to you, you are told that you given access to a BMI calculator, given a beam planning guide for you to easily plan your meal, 30-day fertility diet meal plan removed, given to you as well. You have your exercise training, you have the coaching of the exercise, you have a premium coach that will come and coach you on exercises that you can do, you have regular access to consultation, 30-day exercise guide on the exercises you can do, you have your fertility supplement masterclass as well. You understand your supplement, you are given a supplement review so you know which supplement you even need to use, you are given supplement prescriptions so you can go and get your supplements as well, and which one that is actually at the best for you. You are given constant coaching on availability, for even your supplement. We give you access to results review and medical consultation. We give you access to IVF training course as well so you can understand IVF. We give you support throughout your IVF procedure. We give you medical liaisons that will connect to your clinics and have conversations with them if it's necessary. We give you helpline and support access, which means if you're having issues, you can reach out to us and we'll help you. We give you spiritual support. And finally, we also want to give you access to this IVF success calculator that I used. Remember that it's an estimate, so that you can estimate where you are and know what you need to do so that you can know where you are, and now you can know whether out this program you cannot estimate what this program can do for you, but just know that it can have a 2 times effect and something like that to your IVF success. So wherever you find yourself, that's look at it. Maybe if you can get 2 to 3 times for the program, you may be increasing your chance of success by that. If you have all of these things available to you, do you think you can have success? You can have success. Now, if it's possible for you to actually have success, and let's imagine the IVF is only 50-50, and we had a 30% increment, what is that? Then imagine that that 50-50 now becomes 80%, right? Imagine that you're actually sitting on maybe 60 to 80% chance of success, and you have 30% chance. What does that become? You almost have a certainty of your success, right? So imagine that this program can give you that. Will it be worth it to do this? Imagine that this program is the program that actually gives you your baby. Will it be worth this sum of 5.4 million naira there about that is going to be for the program, if this is the program that gives you your baby? Now let's imagine that, okay, maybe what this program just does for you is that it reduces your chances. You don't need to do another IVF. You only need to do one IVF. How much would that save you? How many millions is it going to save you to go to this program and eliminate the need to do one extra trial, one extra IVF cycle? To save you some millions, right? So, does you see why it's actually possible? Why the best way of actually doing this is to ensure that we give you everything that is within this program, everything that is listed here. so that you can get the best chance. It's the best way, right? It's the best way to get the best chance. So it's actually worth this, right? In fact, some things are not even giving prizes. And some things are even given for free in the midst of this. And we come to this amount. And with this program, it's not also just for you. So long as you are registered in this program, it's for both you and your partner. Your partner can get in at no additional cost whatsoever. It will be worth it, right? But we said that no, this is not what it's going to be. Now, by the time the conversation we're having now is that if we're rolling this program alongside our IVF protocols and having that and wanting to have it at the IVF clinics, what is going to be that it will cost, let me say, at the very least, maybe 2 to 3 million naira to have access to it. That's what it's going to be. But that's not the cost that you need to pay. So what I decided that I'm going to do today, because of the fact that we are going to also be linking you with some foundations that are going to give you IVF support, is that we are going to, because we have two choices in this situation. Number one is make it absolutely cheap that many people can come in, but when we do that, we may not be able to think of the people we are going to be getting to actually be able to run the program for you. We will not be able to get the premium quality. We will not be able to get as much persons. It will not give you the best chance. And I don't know, what would you want? Would you want to get the best service, or would you want to just get the cheapest service? Okay, I presume that you want to get the best service, right? So we said that okay, what we're going to do is that, well, since we don't want to give you the least possible chance of success by doing something haphazardly, let's put a price point that makes it quite nice. And for people that are watching this right now, for people that are, especially people that are going to be part of the program for the IVF support as well, or if you are even distant, you can also have access to this program, because the idea is that even if you are far, it's going to be delivered online. So whether you are within the country, outside the country, because we've had multiple pictures from across other countries as well. Whether you are within the country, outside the country, you can key into the program. So the decided that we're going to give it for almost free, essentially, because we're saying that if you are watching this, you can get access to the program for just 100,000 naira only. 100,000 naira. So all of these things have been shrunk from the cost of 5 point something million naira, 5.4 million naira, to 100,000 naira only, so that you can get access to it. Like I said, we'll have some foundations involved that are also helping us to navigate what all of these things are, and how we can actually make it available for you. Then that is not all. That is not all. And we also decided that there are going to be certain perks to the people that are going to get IVF support. So this is how it's going to work. But remember one thing, at this point you have two choices. You have two choices. You can decide to do nothing, not take a leap of faith, just continue your regular thing. Maybe you live here, you still continue without having your baby, without getting the positive pregnancy test that you want, or getting the pregnancy that you desire, and that's fine. I understand that maybe it's not really what you want to do, but the second option that exists is that you can take a small step today. Consider what you are going to be getting in result and how much you are going to 100,000 naira in comparison for a program of about 5 something million naira. And when you realize that this is simply an investment, it's not even, you are going to be doing it to increase your chance of success, and you are going to have this lifestyle with you too. Because what we have also seen from the fertility diet is that it reduces your chance of heart attack, your chances of stroke, your chance of even dying from cancer. Yes, studies have checked it. Yes, it reduces your chance because it puts you in a consistently healthy state. So you are going to be healthy enough to be there for your children, to be there for your baby that you are going to get, to be able to run around and play with them. So you can do a little investment and actually get your pregnancy, your baby, maybe get your quadruplet, twins, or triplets. Or you can decide that, well, you're going to walk away from this. You don't want to get this optimal effect. You don't want a 2 times increase, 3 times increase, or maybe a 5 times increase in your chance of getting pregnancy. You don't want to add any 20-30% increment in your chance of IVF success. What you just want to do is walk away. So is this program worth spending a few minutes of your time to just check out, to just get into? Well, if you want to, then there's a button around this post that says take your next step. I'm telling you that you should choose your next step or take your next step. Click that. You have options there to get the program, to get into the program. And for 100 persons, Now, this is the point about the IVF support, right? So there are two foundations that are affiliated with us that for the rest of this month now, just for the next few days, women are going to be getting, that is if you are in Abuja specifically, or you are in Lagos and you go to our clinic, you are going to be either getting, if you are in Lagos, you are going to get a 45% discount on your IVF. Yes, the foundation is going to cover the rest for you. So you may be eligible for up to 45%. It depends. What you need to do to be eligible is, if you have your test results, you can go with your test results and you'll be reviewed by the doctor. So after your consultation and review, we'll determine if you're a candidate for IVF. If you are willing to do your IVF right now, and you're among the first, for Lagos 50 people, for Abuja 50 people. If you're among the first 50 people there, then you'll be given the discount range that you fall into and how much the foundation can support you with, in collaboration with the doctor there. So they will tell you how much they can support you. For Abuja, the foundation in Abuja is also supporting 50 people for this month. And what that does for you is that instead of needing to pay any exorbitant amount for your IVF, you can pay the sum of 2 million naira, and whatever is necessary for the 2 million naira, the foundation is going to give support for the other segments. They will tell you to what extent the support is going to be. It's not a loan. It's not like the Access Bank loan that you are going to do. You pay the part you can pay, and the other part of it is paid for you. You are not paying it back. It's removed from the cost of your IVF, but it's only for the first 50 people. And the way to be eligible is visit the hospital. Among this link, after you say take the next step, there will be a link for you there to also visit the hospital, so that you can see the location of any of our facilities in Warri, in Abuja, in Port Harcourt, in Enugu, and in Lagos. So you can see the address. You just fill in a little form there. Once you click the link, it will, if you are going for the program, it will take you directly to the link where you can make payment for the program. If you are not going for the program and you also want to visit the clinic, it will take you directly to a link whereby you can visit the clinic and you can actually get your review done and the support that you are going to need. Now, for people that are going to visit the clinic, there's an extra bonus as well. So if you visit any of our clinics, because I thought that what happened was I considered, I said, people that are in Abuja and Lagos are getting support. What are the people? What about the people that are going to be elsewhere? So if you visit any of our clinics, Abuja, Lagos, Port Harcourt, Enugu, or Warri, what you need to do is that you are going to get a phone number in the form, but let me just call it here. You can write it down: 0915 914 0474. 0915 914 0474. That gives you access to me, the IVF doctor. And after you've made your visit to the clinic, you send me your name, your age, the clinic you visited, and the date you visited. Like I said, we'll have liaison with these clinics, so I'll confirm that you're actually a patient there, and we'll give you access to the program at a discounted cost of 50%. So instead of paying, so you can book your slot. Right now, the thing is this: if you want to ensure that you're among the first 50 people and you want to book your slot for the program, you make your 100,000 naira payment now. Once you visit the clinic and you have had your consultation, you send a message to me, you get a refund of 50,000 naira immediately. You get a refund of 50,000 naira, so that to be part of this program, instead of paying 100,000 naira like what other people will be paying, you will pay 50,000 naira to be part of this program, simply because you visited any of our partner clinics. If you go to the partner clinic and you are eligible after your consultation, so these are the options that are available for you. So just to recap, let me explain it again to you. For everybody that's in this program right now, you are going to not need to pay 5.3 million naira for the program, and you are not going to also pay what we intend to possibly add in addition to the IVF cost. That is about 2-3 million naira to get this program to you in actuality for the general public. Because you are here, you can pay the sum of 100,000 naira using this link below that says choose your next step or take your next step. Use that link, click it, it will show you pay for the IVF preparation program. You make the payment, you can pay 100,000 naira only, and you get access to this program. Then, if in addition to that, that's for group number 1. In addition to that, if you know that you want to get IVF support, then you need to visit our clinic in Abuja or Lagos. Once you visit those clinics, you will be reviewed, and after your review and your consultation, it will be determined whether you qualify for the IVF support. If you do, then you will get discounted IVF for you to do your IVF. You are ready to do your IVF immediately. If you're not ready to do your IVF immediately and you visit these clinics and you send the information to me that you have visited this clinic, what you will still get a discount of 50,000 naira. So you will not join the program for 100,000 naira, you join the program for 50,000 naira only. Whether you are doing your IVF or you are just visiting for a review, any of the two, you will get the program at 50,000 naira only. But the best thing you can do is make your payment so that you can hold your slots. And when you are done with your visits, you send me a message and you get a refund of 50,000 naira for yourself. So you can click the link to make your payment for the program. Then the group of people that are going to not be able to visit our clinic in Abuja or Port Harcourt to get a discount, to get the IVF support, you can also get discounted you can also get discounted access to this program by visiting the clinics in Port Harcourt, Warri, or Enugu. Once you click the link here, once you made your payment, there will be a link there that will tell you, that will ask you, do you want to visit the clinic? And with that link, you can go to the clinic. If you know that you don't want the program, there's also a link here that tells you that I want to visit the clinic. If you don't want the program at all, just click I want to visit the clinic, and you can use that one to get access to the clinic. When you are there and you've done your visit, you can send me a message and then I will follow up for you and be your liaison and all those things. What I've also decided to do is that for everybody, whether you getting the program, you are not getting the program, you are visiting the clinic, you are not visiting any of our affiliated clinics, you are going to also be getting You are going to be getting. There was a plan I had for you guys. Just give me a minute to get. If you know that it has actually been a lengthy lecture to ensure that you actually get everything done. Okay. Okay. So essentially, because of the fact that you have been able to go through this program, the thought process is that you are going to be able to get on a consultation call with me for everybody that is here. But okay, that one, because of the volume of persons. Okay, let's navigate. Okay, what I would do for you is that everybody gets access to the BMI calculator. So if you say, you can also drop your details here. Some of you that may not be interested in any of these things right now, you can also fill a form. Just to, once you click the link there, they say take the next step. You don't want to get the program, so you don't get the program. You don't want to visit the clinic, so you don't visit the clinic. You can click order. What that order will do for you is that if you fill in your details there, I will send you updates where we have other courses that are available for you and that you can take. And because I'm also intending on discussing 10 reasons for IVF failure very soon, do the masterclass on that possibly, and how you can avoid them in your IVF. So you can be part of that program at that time. Just fill in your details for the Google form that you are going to get access to, and you will get that. Then for the IVF success calculator, everybody that is here, once you fill in your details, you also get access to the link so that you can estimate your current success, your current potential success, and you can now know how the program may possibly increase your chances of success. Before, this is standard worldwide. If this is some information gathered across a number of women that is used to postulate success, remember that it's not a true indicator. It's just to give you an idea of a possibility of where you may actually be standing at this point. And some of you may be thinking, would this work for me at my age? Yes, it works for you. This IVF success program, in fact, there's a patient right now which has been 8 years menopausal. 8 years into menopause as at the time she came in for she had been 8 years into menopause as at the time she came in for her procedure. After optimization and after, okay, yes, so she even had one tube blocked at that time. After optimization and after the procedure was done, she has given birth today. 8 years menopausal. There's another patient. If some people say, oh, I've had surgery, will this still work for me? For this fibroid surgery, that one, yes. There's a patient, she's a mother of twins today. She was 14 years old at the time she came in. She had had 3 types of surgery before. Her tubes had been cut, bilateral salpingectomy. She had had fibroid surgery, myomectomy. She had had fibroids before. So she had had the ovarian cystectomy, yes, at that time too. She did that procedure. She's a mother of twins today. If it's a matter of even if I have sugar, high blood pressure, can it work? Yes. The idea is that what this optimization does for you is to get some form of control over those things, so that you are less likely to get into complications when you get to your procedure. It can work as well. Some of you may be thinking, no, I'm very far, I'm not in Nigeria. Can I be part of this program? Yes, you don't need to visit the clinic. You join the program. I will tell you the times for the consultation sessions, the question and answer sessions, the coaching sessions, get access to the materials, and you can be part of this program. You understand? So, like I was saying, for as many of you that are here, if you don't want to be part of the program, or you don't want to even come to the clinic, you can still get the BMI calculator. You can still get access to the BMI calculator, access to the fertility success estimator as well. Then if you leave this thing, you may also get access to the IVF masterclass, so that you can also we can also get access to the IVF masterclass, so you can understand what the IVF procedure is. Within the masterclass as well, you can also get access to a link to a video whereby I answered over 27 questions. Yes, over 27 questions about IVF that are usually being asked. IVF for low sperm count, for blocked tubes, for different things, donor egg, ICSI, what those things are, what size cycles, all of those things are all encompassed within this thing. So once again, just one last time, let me just explain to you what you'll be getting in this program, so that you know what you are expecting by the time you are coming into this program. That way we have packaged it to ensure that you have success. Fertility Mindset Masterclass at a cost of 200,000 naira. Weekly mindset coaching and consultation, 500,000 naira each, coming to 1 million naira. Meditation mantra, 100,000 naira. Meditation exercises, daily meditation exercises for you to do, 100,000 naira, bringing the cost of the fertility mindset aspect of this program to 1.4 million naira. You'll be getting it essentially for free right now. Fertility diet bootcamp. The diet bootcamp on its own is 200,000 naira. The fertility dietary coaching is 500,000 naira. The fertility dietary consultation, because we have, for every one of these things, the plan is to have 8 weeks where you have access to all of these things. 8 weeks. So at 150,000 naira per week, that comes to, at 150,000 naira per week, that comes to his own, that comes to about 1.2 million naira of his own. You get access to the BMI calculator. You get access to the meal planning guide. You get access to the 30-day fertility diet meal plan. That comes to about 1.3 million naira for that. In addition to the previous 1.4 million naira, it's supposed to be 2.7 million naira, but you're also getting it for free at this point. Fertility exercise training, 200,000 naira. Fertility exercise coaching, 500,000 naira. Fertility exercise consultation, 500,000 naira. 30-day exercise guide, 100,000 naira. You still have access to our premium fertility diet coach, which means that it will be available for live sessions. There might be sessions whereby you can even join in for exercise. You can join in for exercise, so that they can guide you through the exercises. Beyond that, the cost of the fertility exercise aspect of this program is 1.3 million naira. You are going to be getting that also for free. So instead of the program costing you 4 million naira right now, you are going to get all that for free. Then fertility supplement masterclass, 200,000 naira. So reviewing your current fertility supplement, 50,000 naira. Supplement prescription of new one, 50,000 naira. Supplement coach, instead of it now coming to 5.1 million naira for this program, you are going to be getting that aspect for free too. If you are among the people that are going to take advantage of this offer of the discounts that are available right now. But that is not all. We did not stop at that point. IVF success calculator, you can get access to the link. Results review and medical consultation is supposed to be costing about 250,000 naira, but you are going to be getting that. IVF training course, you are going to be getting that for free. Support throughout your IVF procedure, you are going to get that for free. It's a priceless thing, but we are going to give it to you. Medical liaison with your hospital, if you are using any of our fertility clinics, or out of your medical liaison, we will be there to have conversations. You are getting it for free. Helplines and support access, you can reach us with your questions and we'll be there. Spiritual support and a prayer group, so that you can be part of prayers, you also have that. All of this, instead of paying 5.4 million naira for this, you are getting it for the cost of just 100,000 naira if you take advantage of this offer. So if you want it, click the link below that says choose your next step or take your next step, and you go to the IVF preparation program, click the link and make your payment. From there, you will get access to the first aspect of the course and the first instructions to do. You will get that. If you want to come to the clinic and you want to get a review to see if you'll be eligible for fertility support, which is something you are also getting, all of these things are available for you. If you want that, you can pay for the program. If you want the program at the clinic, pay for the program, then go to the clinic. You choose the clinic that you want to go to, you go there. After you visited the clinic, whether you are going to Abuja or Lagos where you can get fertility support, financial support or not, after you visited the clinic, you send a message to me with your name, your age, your clinic you visited, and the date you visited them. Once you send that to me, you are going to get 50% refund of your 100,000 naira that was paid for the fertility support for the IVF preparation program. And everybody, if you want updates on various other classes, you want access to a class on IVF and questions about IVF that we answered, you want access to the BMI calculator, you want IVF to the IVF success calculator, and you don't want to be part of the program or anything, you can click the link, choose order. After clicking the link, don't choose going to the clinic, don't choose paying for the program, and you can get access to these things after you filled in a short questionnaire. You get access to all of these things. I think that is enough to help out, right? That is fair, right? So thank you very much. I wish you success, and I'm looking forward to your baby dedication because I like dedication rice. I like the celebrations actually. I'm looking forward to the baby dedications. I'm looking forward to your naming ceremonies. I'm looking forward to all of this, and I wish you success. Have a wonderful day. Goodbye.